with Senior Care Partners PACE. We get the ability to work with folks in Kalamazoo County, Calhoun County, Southern Allegan County, Southern Berry County, and Eastern Van Buren County, with the potential here, hopefully, within the next 12 to 15 months to push into St. Joe County and branch counties.
I will hop in. My name is Sarah Milanowski. I am a social worker with LifeCircles PACE and have been doing outreach work, helping people join the PACE program and learn about the PACE program for about 6 years now, between 2 different PACE programs. I serve with LifeCircles, and we cover the lakeshore of West Michigan. So basically, we work with participants all throughout Muskegon County, the majority of Ottawa County, with the exception of a few zip codes that actually go to Veronica's PACE program in Grand Rapids, and then the western portion of Allegan County, sort of near the 131 corridor towards the lake. So we go all the way down to South Haven. And LifeCircles PACE has been around for about 11 years. And we are looking forward to continuing to get the word out and help people understand what PACE is, why we have different names, and all that good stuff.
Hi, my name is Veronica Horsley-Pettigrew, and I'm with Care Resources PACE. And our PACE program has been in existence for about 14 years. I've been with PACE for going on 4 years, going into my 5th year. Wow. And we cover all of Kent County and 5 zip codes in Ottawa County. And so we're looking to give access to more seniors in the community and to learn more about PACE and the wonderful services that we all provide.
All right, so Veronica, thank you, and Sarah, thank you. So I think to get things started, I think we've only got an hour today, and so we've got a lot of information that we would like to share with everybody that's on here, but then at the same time leave some time for some questions and answers, whether it be for us as the PACE experts, as Chris calls us, or to David and Chris as it relates to any legal questions that may arise. But for those of you who don't know what PACE is an acronym that stands for Program of All-Inclusive Care for the Elderly. And really, our primary function as a PACE organization, whether it be Senior Care Partners PACE, Care Resources, LifeCircles, Tome PACE, I mean, we've got, I think, 12 or 13 PACEs in the state of Michigan, but we all have one fundamental purpose for being in business, and that is to work with the frail elderly in our communities to provide them with what we feel is the best alternative to nursing home placement. We know that given the choice, most people in the community would prefer to age in place in their home as opposed to going to any other type of facility, whether it be an assisted living or a skilled nursing facility. The struggle with most people being able to do that is the lack of access to health care, and that's where PACE comes in. So under that name, Program of All-Inclusive Care for the Elderly, individuals that take advantage of a PACE program are able to get access to all medical care that is needed to keep them independent in their home, with a team, an interdisciplinary team within each organization, working for each aspect and working on each aspect of each individual's life to ensure that we're maximizing all services to ensure that everybody's getting everything that they need to have the control over their care and getting access to that care that they need. So everything from chore providing to transportation to and from doctor's appointments, and or our day center where the clinics are at and the medical providers are at, where we have social interaction, activities, physical therapy, occupational therapy, as well as ancillary services, maybe your pulmonologist or cardiologist, are all in our network of providers. And so that helps us kind of be your one-stop shop to ensuring that you're getting pointed to and getting access from anybody out in the community that can help with that. So that is kind of in a nutshell. And, you know, as Sarah and Veronica start to talk a little bit about what they're doing, you know, maybe they would want to elaborate on some of the things that I've touched on. But in the interest of time, I just wanted to kind of give a brief overview, and maybe you guys can formulate some of your own questions that we can answer at the end in the event that I've missed something. But one of the things that that we were asked to discuss as it related to PACE with Chris and David was, how has this COVID pandemic, not epidemic yet, right? Pandemic impacted the way that we care for individuals. And I think that as a PACE organization, we have a lot more flexibility than a lot of other providers out there have. And with that being said, Veronica and Sarah are going to be able to kind of share with you how that flexibility works and how it looks in each of our respective centers. But before we got into that, I wanted to take a minute to just share with you a little bit about why not only do we feel that PACE is the best alternative to nursing home placement, but that statistics show that PACE is, in fact, the best place for people who are facing the option of having to potentially be placed in a nursing home or going to an assisted living facility. And I want to pull specifically from the coronavirus website that was shared on, it's on michigan.gov, right? And so I know that we're all just kind of overwhelmed and tired of hearing about coronavirus, but the reality is that it's not going anywhere. Some will argue that we've done a great job with it. Some have argued that we haven't done a great job with it. But these are the hard numbers that we are seeing in our state today, numbers updated as recently as 10/13, okay? So in the state of Michigan, and I want you guys to understand that we get an opportunity to work with individuals that are 55 years of age and older. And unfortunately, the data that's on the coronavirus website, it stops at 59 and starts at 60 and goes up. So some of this data is going to be a little bit skewed to our demographic, but in the state of Michigan, we have had a total of 137,702 confirmed cases of coronavirus, okay? And of that number, 36,077 are of individuals that are age 60 and over. So individuals that fall into our demographic represent 26% of all people who have been diagnosed with COVID-19. In the state of Michigan, we have had 6,928 people pass away due to COVID-19. Unfortunately, the people age 60 and over that have died of COVID-19 are 6,052. That means that 87% of all COVID deaths that have happened in the state of Michigan have occurred in people that are age 60 and better. Okay? Of the 6,052 people that have passed away over the age of 60, 2,188 of them, the deaths occurred in a nursing home. So if we break down and we extrapolate those numbers, what that means is that 36% of all COVID deaths that have happened in the state of Michigan have come from nursing homes. Okay. Currently, there's been 8,888 cases of COVID diagnoses in nursing homes. And as we just discussed, 2,188 of those people have passed away, which means that 25% of all people who contract the coronavirus in a nursing home pass away. Okay. The statewide average in comparison is a 5% mortality rate. All right. So to go from 5% statewide fatality rate to as much as a 25% fatality rate in the skilled nursing facility COVID contracted cases is significant. So we recognize that our outcomes that we're working on with people in their homes are having a much better impact on the outcomes of people who either have contracted COVID, but more importantly, even those that have not contracted COVID, because we're putting them in a situation where our use of PPE are helping them stay in their homes, and avoiding these congregate settings is keeping them less susceptible for contracting the COVID disease, because we recognize that if unfortunately they contract it, that there's a very good possibility that someone's going to pass away from it. So that's why, amongst everything else that you've ever thought about having to go to a SNF, why you wouldn't want to go here, this is one more reason. And for those of you who don't know, all these people that have been in a skilled nursing facility, and even most assisted living facilities, while they've been in there, they've either not been able to have visitors, whether that be family or friends, or if they are able to see them, it's at a very limited capacity. And so the social isolation, even though they're surrounded by people, is very real, because they can't be surrounded by their loved ones. Okay, so I know I hate talking about passing away. I hate talking about fatality rates, but the reality is that COVID's not going anywhere. Are we doing a better job managing it? Yes, I think we are. But that being said, the most at-risk people are the people that we get an opportunity to serve every day. We feel as though we present the best option for those individuals. And with that, I'm going to go ahead and turn it over to either Sarah or Veronica. I'm not sure which one's jumping in.
Well, this is Veronica. I'm going to jump in. That was amazing. I didn't realize some of those numbers myself. COVID presented something different for us. I just remember the day that we were told to go home. And what I remembered was we ran out of this building and out of the parking lot as though something was chasing us, but we didn't know what it was that was chasing us. And so then we had to kind of go home and regroup and say, what are we going to do and how are we going to take care of our people? The beauty of PACE is that we have the flexibility, and we have supportive services. So what that means is normally we kind of push the day center, bring people into the day center, do activities, and give them lunch and play bingo and games and socialize. Well, once COVID came along, that shut everything down. So we could no longer bring them into the day center. So then we had to decide what we're going to do. But because we have these supportive services already there, we were able to ramp up the services that we already had in place, which was amazing. So we didn't have to reinvent the wheel. We just had to make the wheel bigger. And so I have some numbers from March 16th through October 3rd. We delivered 3,596 meals to our participants. We did 5,820 activity bags. And some of our staff members made videos, exercise videos, and did some videos for activities so that to keep our participants engaged. We did 22,500 home care hours, which means we ramped up our home care hours to give more time. We were usually bringing people in for showers. We were doing more of that inside the home. The social workers called more. We did 8,262 social work calls, and that was weekly, calling everyone to keep them engaged. And COVID was kind of a surprise to us, and a lot of people went through a lot of emotions throughout that time. And some of the elderly live by themselves, and so the social workers were calling more often. And so then we had one person, our staff, that she made what they call happy calls. And these calls were separate from, talking about medications and things like this. Happy calls were just talking about more personal things to be more social. And then it gave us an opportunity to implement Zoom like this, because we weren't doing Zoom prior to COVID. So we were doing Zoom meetings, and we did we got a grant for telehealth monitoring, which has been awesome. And so we have what they call CareLink monitoring system that has like an avatar, a dog or a puppy, with the monitor their blood pressure, remind them to take their medication. They can read a book and talk to them that way. And so that has been very, very helpful. So I love this program because, you know, we adapted. You know, COVID came in and we had no idea, and we made the adjustment, and we were still able to take care of our participants. Now, things are opening up a little bit, and so we're using our day center a little bit more, but we're only averaging 20 to 40 people per day, and that's only for half a day, and they come in, maybe they'll get a shower, get something to eat, do some activities. But we are able to kind of rotate everyone in a week, but it's just not like it was, but it's better than it was when it was the thick of COVID. So there were some, you know, it's been not the most fun thing, but some key things have come out for us. And to me, it just let us know how awesome that we really are, because we were able to, we didn't have to go out and like some places and totally close. We're just like, okay, we're just going to make an adjustment and just jump over here and just beef up everything. And we had the staff, and I have to say that we were very fortunate to keep everyone healthy. Which has been a wonderful, wonderful thing. And I've been very fortunate. I've worked every day. And so now I'm coming into the office. So we were able to do that as well. And that's, I think, the beauty, and speaks to the organizations of PACE, all the PACE programs. So that's all I have to say. That's on you, Sarah. Thank you, guys. They say I get a little long-winded, so I had to slow it down a little bit.
Not you, Veronica. Well, I just want to say thank you to David and Chris for giving us this opportunity. As PACE programs, when we do finally get to talk to someone about the program, we often hear, gosh, why didn't I hear about this sooner? You guys have been around for 15 years in Michigan, and why haven't I heard about this? Well, PACE programs traditionally are nonprofits. We invest our money in the care that we provide to people. That is our number one thing. So unlike a lot of the nursing homes that have big for-profit parents that buy those big billboards and buy advertising space, it's not likely that you're going to see many PACE advertisements, because we reinvest in the care that we provide. So we love to have a platform like this that Chris and David provide to us, that they get the word out about PACE, that people like you that are new to learning about PACE just say, hey, have you ever heard about this PACE thing? That's what we depend on to share information about this really phenomenal program. Greg didn't get into it, but you know, even our quality statistics, when we compare ourselves to hospitals that serve people who are 65 and older that go into the hospital to get treatment, when they get readmitted within 30 days, sometimes that's 10 or 15% of people go back to the hospital for the same thing that they had that brought them to it. When someone's in a PACE program, we have significantly less rehospitalization rates, and all these numbers are great, but what's real is when you see it impact the person. We know that going to the hospital is difficult for a frail older adult, someone who's
Boy, don't you just love technology?
We do. I think when Sarah
Hey,
comes
guys.
back. Okay, she's back.
Am I back? Okay, sorry about that. Basically, I was just saying that going to the hospital for anyone right now is not great, but for the participants that we work with, it's not ideal. So our team puts every energy they can into being creative to help people manage their illnesses right in their own home and have the support that they need to do that successfully. The beauty, we haven't really like ticked off all the awesome things that PACE can provide, but the beauty of a PACE program is the creativity and the flexibility and the innovation of these really skilled professionals that work with older adults. And our team is funded in a different way than most healthcare programs. So if someone needs physical therapy, say, they usually get it in their home for maybe 6 to 8 weeks if they're lucky after they get out of the hospital. With a PACE program, as long as your physical therapist and your team believe you need it and are benefiting from it, we can continue that therapy for as long as you need it. So we often hear people say, gosh, this is healthcare made sense again. You know, sort of the same things. Sometimes people say, gosh, I went in for a hip replacement, Medicare paid for my walker. It's 6 months down the road, I had some other accident, and now I need a different walker, but Medicare won't pay for it. Well, in the PACE model, we're taking away those weird insurance rules and focusing on prevention and investing in what's going to help someone stay successful and make sense. So we can supply the type of equipment someone needs as they need it. The wonderful thing about a PACE model is that if the team thinks that it's necessary, we can help get a ramp for the home, so the home's wheelchair accessible. We invest a lot into helping someone live in their own homes for as long as possible. And many people can't even fathom that someday they won't have to go to a nursing home. But we've seen with PACE services, if we get in there soon enough, that we're able to prevent those big spirals and help someone stay stable in their own home and live more on their own terms. And then sort of circling back to the COVID thing, the thing that I've been most impressed with our PACE organization is, you know, yes, the older adults that we work with are the most vulnerable to this virus, but there are hidden costs to having everyone isolate in their home and have reduced services. And so our team is also able to say, look, we're not your parents, we are your team and we're alongside of you, and you have to make some choices for your risk tolerance. So as we've opened our day center up on a limited basis, we're asking families and individuals, you know, you're increasing your risk by being exposed by coming out of your home. But if you feel like having more socialization, having more experiences with people, the caregiver needs more of a break. If that risk versus benefit makes sense for you, we will support you. We are the team of champions surrounding the individual. We don't dictate the care. The individual dictates what's important to them. We're the experts that provide the options for care. So I think that's the beautiful thing about PACE programs. I think that's really my soapbox for today. I could go on and on and on as well about all of the exciting things that PACE programs offer. The big thing is just all-inclusive care. Anything and everything under one umbrella is coordinated and covered by the PACE program. So you have one-stop shopping. You have more relief for someone who's the caregiver. They don't have to call around to 3 or 4 different agencies, doctors' offices, physical therapists. It's one phone number and you have a whole team of people that work together and understand what the different parts of the team are doing so that things are moving forward in the direction that you want to go. So that's why they call PACE programs the gold standard of senior care. We just wish more people knew about them.
You know, I forgot to mention, I remember I ran out of medication and I had to go out and get my medication, but our participants they did not have to go out and get their medication. We delivered the medication to them. So that lessened their risk of being exposed to COVID and being able to stay at home and stay safe. And so we took the risk and went out and took care of the things that they didn't need to take care of. And I think that is amazing. I wish somebody was taking care of me like that. I had to go out like we all did. So that was that's a wonderful, I mean, to have people care about you like that and a team of people, I think is amazing. That's why I love this program.
Yeah, and there's one more thing. Sarah had kind of alluded to it a little bit here at the end of her talk, and that's caregivers. And I will tell you that, and we're seeing a lot of it in my neck of the woods. I've got to imagine that it's happening statewide and nationwide as well. Excuse me. Is caregiver burnout, especially during this time of COVID, with places closing down, with they with less access to healthcare, and some of these organizations, cutting their services that they used to be able to do, or taking on new patients due to the COVID pandemic. What we found is that many caregivers, whether it be the spouse, whether it be the kids, have been called upon to help mom and dad, grandma and grandpa, aunt and uncle in a much greater capacity than what they have ever had to in the past. And so it's brought light to the fact that we thought mom and dad were doing better than what they were. On our 20-minute Sunday conversations, they seem to be fine, but I recognize that once I spend 25 minutes with mom and dad, that it's harder for them to hide the fact that they are dealing with some things. And to the other extent is that, they may have had a chore provider that was coming in, and that person got sick and could no longer come in. And so now the son and daughter is having to do that and manage their own family and try to stay protected and do things to protect themselves so that they don't, impact the health care of mom and dad. And we're seeing a negative impact, if you will, on some of those caregivers, not intentionally, but they don't want to do anything they don't want to say no to mom and dad. They understand the need. And so they're burning the candle literally at both ends. And what ends up happening at that point is that either the care begins to drop, or tempers begin to flare, or, things start to arise. And so we have received many more calls from people who have basically hit the wall, if you will, and said, I can't do it anymore. I need your guys' expertise. So recognize that when we get a forum like this to be able to share with individuals who it is we are and what it is we do and how we help those out in the community, we're not just talking to a potential participant, but we're talking to caregivers, but we're talking to friends, we're talking to family, right? We all know somebody who's caring for somebody that could probably benefit from our services. And with that being said, if you've heard anything today that you think somebody that is in your inner circle would benefit from the knowledge of, please reach out to the carrier's office, reach out to Chris, reach out to your local PACE organization, and see if there might be opportunity for assistance to be available to you. It's not a hard sell. We promise you that. We're here to help those who qualify for our program, and we will do what we can. And David's saying it's a hard sell, but it's not a hard sell, right? So, so I think that's what we've got kind of wrapped up for you guys. We would love to turn the floor over to David and also Chris to see if there might be some questions that arise.
Well, we love PACE with a deep and burning passion. We just love you guys. It's the favorite thing, we have to recommend for folks. Every week I do 2 hours on the radio, and, 1 hour and 59 minutes is singing the praises of PACE. We do a weekly full page every week. Comes out twice a week in the MLive newspapers, the Kalamazoo Gazette, the Grand Rapids Press, across the state. And for us, the big thing is PACE. And it's frustrating. I did 7 minutes on PACE this morning on 8 West. So if you look at Channel 8, Wood TV, we spent most of the time talking about the expanded eligibility for PACE, which is now expanded, of course, until April. And, one of the things that for me is a touchstone, having seen it in my own family, spouses will take care of each other to the point of killing themselves. The idea that till death do us part, and the whole thing is the spouse will kill himself, keeping the other one out of the nursing home. And when they finally succeed in wearing themselves out, well, where do you think the other one's going? Right to the nursing home. And PACE is just such a beautiful, jigsaw puzzle fit for that, because you can continue to take care of your spouse without killing yourself. How nice is it that once, twice, maybe 3 times a week, the little bus comes, and now you can go shopping or just hang out with your girlfriends or your guy friends, whichever, you know? And that's what PACE brings to it, seems like to me. The one difficulty you have with PACE, that we have with it, and I don't know how you get around it. I'm not sure you should get around it. And that is, people can't believe it. They don't believe it's that good. Of course, the reaction once people are on the program is, well, thought it was too good to be true, and it turns out to be better. Well, yeah, actually. But we sure do love us some PACE, I got to tell you. And now with the expanded eligibility, of course, for a lot of folks, the income limit was a problem. And now for going on 3 years now, we've solved that for people with married couple. And if it was a pension, putting one spouse over, the spouse who needed the care, putting them over, there's things we can do. People don't want to give up the cottage. Well, you don't have to give up the cottage anymore. People don't want to give up the IRA. Well, you don't have to give up the IRA anymore. And until next April, these rules are extremely generous. And, you know, like today on the TV, I was, you know, you had a chance. If you blew your chance, because, you know, the old rules are supposed to take effect in November, well, you just got a reprieve until April, you know, your April Fool's Day, you know. You're an April Fool if you don't take advantage of this stuff. It's there. It's not that hard. It's, you know, it's a lot of ins and outs because we're trying, the PACE organizations. See, here's the other thing people don't get. The PACE organization is not the government. PACE organization is on your side. We're all trying to get money out of the government. They are, we are, we're all trying to do that, okay, in order to provide the service. They are really, you know, it's not a conflict situation. It's a cooperative situation. So, like I say, we just, and we see the good, you see the good that it does, you know, time and time and time again. So, you know, that's, you know, legally, technically, it's a pretty unusual case where we can't get someone qualified for the PACE, you know, in terms of shifting income, that kind of thing. So there's a whole lot of people who may have been told, accurately told, that they don't qualify for the PACE because their income is over. Like I say, we've pioneered some changes. We go to circuit court, we move IRAs around, we move pensions around. You can actually do that. I know people say, oh, you can't do that. Oh, we've done it a few hundred times already. So this is not experimental stuff. It really does work. And, you know, we just big believers in it, you know. So any questions, I'm happy to take them. But
yeah, does anyone have any questions for any of our team here? I have a question. What is the evaluation and assessment period? What does that look like now in COVID?
Well, we're going in the home, still doing assessments. So it's about, it depends. If someone has Medicaid, we can possibly get them in 2 weeks, sometimes in a week. If they don't have Medicaid and Carrier Law's office is still working with them, it might take 60 days. Just depends on, you know, what is needed to get things resolved. But someone calls in today, we can schedule them to go out possibly tomorrow or the next couple of days. So we are going in the homes doing assessments, and they're coming here to the center to see all the primary all the providers here for assessment as well.
And then to piggyback off of that, because PACE programs do receive payment from Medicare and Medicaid, we have to answer to Medicare and Medicaid on their timelines and their rules. So unfortunately, the state says we can only enroll someone to start a PACE program on the 1st of a month. And then there's another deadline that we have to hit before that. to get enrolled in the program. So it's not an immediate call today, get served tomorrow. It's that we can start assessing you. And the beautiful thing about a PACE program is that the whole team is trying to understand your needs from a lot of different perspectives, so that day one, we're able to meet you right where you're at and help you reach your goals of staying at home. But it takes a little bit of time to get through the process for the program to actually kick off. But I can guarantee all three of the PACE programs on here will do everything they can to move you forward through the process. And if that's partnering with David's office, we will move heaven and earth to get people eligible as quickly as possible.
And our cutoff time is, Medicaid says we have to have everyone completed, all the paperwork in by the 24th, assessed and everything by the noon by the 24th. So we are working now to get a few people in by the 23rd, which is Friday at noon. So we can have a little flexibility if we do it before noon, the 23rd on Friday. If someone had Medicaid and they called in, it doesn't happen always like that, but it can, and it's a crunch time for us. It just depends on the time of the month that it is, how quickly we can get someone through the process. If we started, say, the 1st of, started the 1st of October, we definitely could have them completed if they had Medicaid, Medicare by the 23rd of October. If not, it might take until November, and we can't start them till December 1st. That's the thing about PACE. The state says you can't start until the 1st of the following month. That's okay. You know, it takes a little time, and then we're not pushing you through really, really, really quickly. You might want to go a little bit slower. Just depends, you know, and sometimes we turn things around rather quickly, and sometimes we slow it down because that's what people need. We meet people where they are. And so if you say, I want to do this today, but I don't want to do anything else for 2 weeks, that's okay. That's what we will do. So wherever you are in your process of making this decision, we will meet you there to do that.
Yeah.
What if I want to go to my own doctor? How does that work?
Well, you're in luck. So in the past, PACE, when I first started, you had to only use our primary physician. We in our clinic that we have on site here. But a lot of people have attachments to their primary physician. I mean, I have a physician that in St. Joe, Michigan, that I did not want to leave, but I had no choice. So I had to do that. It was very difficult because we know that you build a relationship with your physicians and you trust them and you feel comfortable. So what we have done, we kind of looked at that whole process. And so now as long as your doctor agrees to coordinate with our physician, you can keep your physician and see them twice a year.
You know, our experience along those lines has been, I've been with Marcus Welby forever, and we love Marcus, and Marcus Welby's the greatest. But then when they start going to the, especially to the senior center, and everybody's got Dr. Kildare, well, pretty soon Marcus is yesterday's news, and everybody likes Dr. Kildare. You know.
That's a good point, David. I have to tell you that I get this all the time for people. I don't want to leave my physician, and we give them that option. But I have to tell you, there hasn't been one person that once they come to the center, I mean, there hasn't been one person who has said, I still want to see my physician. It hasn't happened. But
it doesn't work, yeah. But you have to make it. You have to make the option. You have to give them the option, and then they won't take advantage of it. You know, because they don't want to. It doesn't. You know, here's the other thing that we get a lot of, especially from the kids. Oh, Dad will never go for that. Oh, Mom would never do that. Oh, you know, like the parents would reject it. And then those are the people, lots of times, and the kids are thinking, well, because they're withdrawn and unsocial and stuff. The thing is, your parents don't want to be outgoing and social with you. If they were in a group of people who understand what World War II and Korea were all about, because they kind of went through it, different story. And we've had women, it always seems to be the women more than the guys, but, you know, who absolutely blossomed. You know, when the kids are like, I don't know what happened, but Mom's a new person. Yeah, because she's talking to people who understand what she went through.
Mm-hmm.
I mean, that's been one of the hardest things about this COVID, I think, has been the loss of that socialization opportunity for a lot of our clients. Very, very difficult.
Yeah.
And I just
question. Oh, sorry, Greg.
I just, before we get off subject, I just want to say one thing, that the 3 PACE, or Sarah, do you allow 2 visits?
We allow 2 visits your first year. We've been offering it for 3 years. No one's ever taken me up on it.
Okay. So I just want everybody to know on here that that is not a mandate. That's not part of the PACE model of care. It's not something, typically when you enroll in a PACE program, you give up your primary care physician day 1, and we become your primary care physician. The PACE organizations, again, in that flexibility that we're able to extend to our participants, decided that yes, it was something that we needed to make an option for our people so that they felt comfortable moving forward with us. And, you know, to the other 2 presenters' point, very rarely does anybody ever take us up on that. And if they do, it quickly goes away, because the rapport and the relationship that they establish with their new primary care physician through us becomes so much stronger that they don't need it. So just know that, again, that's just another example of the flexibility that we can, I guess, showcase as a PACE program.
Yeah.
On average, our physicians and our medical providers spend much more time with the people that are coming into the center. They're not just standing in the corner typing in their computer saying, yeah, what's wrong? See you, you're out of the office in 5 minutes. They sit down next to you and they're spending 20, 30 an hour's time with you. They're going to your home and sitting at your bedside. And not only are they spending that quality time, they're doing a lot more listening than they are talking, because those are the crucial bits of information that really make the difference about what's important and how we can serve you. And then the frequency of visits. Not only are you seeing the doctor more often, but you're seeing our nurses more often. You're seeing our social workers more often. So on average, someone who might see their doctor 4 times a year in traditional Medicare, we're seeing at our PACE site, on average, they have 17 visits, 17 points of contact with their medical provider. You can only imagine that the amount of care that you're getting that makes sense just for you, that's customized just to you, is significantly greater, right? That's the beauty of this model. It's meeting people right where they're at, and our core of every one of our professionals is to understand what's important to the people that we serve, so we can help them, because we know the desire is to live at home and to not be in a facility with a roommate you don't know, and 4 cinder block walls with people that you don't know coming in and out at all hours.
Yeah.
Well, you know, one of my favorite stories along those lines Sarah was talking about, you know, when you get older, it's the underpinnings that go first: the feet, the ankles, the knees. And this one client was going to see, on Medicare, going to see the podiatrist 4 times a year, you know, trim the toenails and massage the feet or whatever. And that's what she was doing, you know, 4 times a year. And now she's on PACE, and every week she's seeing a therapist, you know, physical therapist or somebody, you know, the toes are getting tickled or whatever it is they do. She's walking more now than she has in the last 20 years, you know? And it's just like, it's, you know, it's 5 minutes with the physician's assistant or whoever it was. And now she's walking around the track and she's chatting with her friends, and you know, and the difference in the quality of life between somebody who's doing that and somebody who needs a lift chair just to get up, you know, there's no comparison. And then, you know, you got all these people, oh, this is what people say, oh, when I get old, you know, just take me out back and, you know, ka-ching. And it's like, well, you know, there's a image of what it's like to age where that seems like a good idea. I wouldn't hear it as much as I do from people who tell me that that's their long-term care plan, you know, Smith & Wesson. Okay. I don't know anyone who's ever done it, but, you know, that's what they say. Well, when you realize that you can really have another 20, 30 years of activity, meaningful activity, with people who are not from the planet Mars, people who actually understand what you went through, and you're living in your home, you know, how many here have paid off their younger folk? How many have paid off their mortgages? You know, that's a huge, big deal. Having that home, having the lawn, you know, get off my lawn. having, you know, that space that belongs to you and being able to keep it, you know, I mean, it's just, you can't say enough good stuff about it. But maybe we shouldn't say so much good stuff about it because people don't believe it. No, I don't know. Hey, and Veronica, when are you coming back on a radio show?
Oh my goodness gracious. Had to get up so early that morning. I was on the radio with David. Oh my goodness. I don't know where he gets all this energy from at almost 5 o'clock in the morning. I think it was, what time did I come? 6:30 or something like that?
Yeah.
Oh my goodness. I'm going to have to do.
The show was 7 to 9, but we had to do our prep.
Yeah, it was good. We had fun.
Here's a cup of coffee and the headphones.
I'm going to do it again. Yes, I enjoyed it. Thank you.
Right. But you know what I'm thinking, because you know as you say, and it's certainly a thing for us, the getting the word out. I mean, maybe you know, if we went to the TV stations, you know, I bet you we could get airtime. I bet you we could. I'll look into that.
Let me know. Okay, great. We appreciate that. Isn't that right,
Yeah.
Sarah? Yeah.
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 I'm sorry, Greg. We already have one bald guy, so I need the photogenic lady.
Understood.
Well, you know, you can't have the studio lights bouncing back and forth. It burned the place down, I'm sure.
Yes, 100%.
Absolutely. I'm open to that. Thank you.
All right.
Does anyone have
Okay.
any questions that they'd like to ask before we wrap up?
Don't be bashful.
All right, I want to know how many people on the call are caring for a loved one right now. Your spouse has an Alzheimer's diagnosis or some other diagnosis. You know, if that's you, say hello. Because you're the one that this program is for. I think, first and
I'm
foremost.
caring for a person that has multiple sclerosis. And
Perfect.
he's at home, and I understand the things that you're saying would be maybe helpful for me, because trying to get caregivers is very challenging at the cost that they charge, you know, for somebody to, you know, be overnight, or like if I wanted to go on a vacation or something like that. Or just the simple getting help with a shower, or getting help with a nail clips, or, you know, whatever the situation might be. I've been pretty fortunate because he is still mobile and for the most part can do a lot of things on his own, but not always. There are some times where, you know, he's having bad days. So,
So now's the time really to start investigating getting him into a program like ours, because it will allow us the time to get to know him and his wishes and his plan of care and so on and so forth, you know, in the event that something were to happen and we had less time to get to know him. It's just certainly going to help with the overall level of care, as well as making sure that everything is being met. And then also providing you with that level of respite. If you did want to take a vacation, we can help with making sure that he's getting everything that he needs while you are, in fact, away. That is part of the program.
okay.
So something to consider. And you'd be surprised how many people that are exact same boat as you that we help every single day.
And dare I say, with this time clock that we're running on with this April thing, it is important to get that assessment by a PACE program done sooner rather than later, while working towards those other goals. I'm sure David can spend a lot more time explaining that, but the assessment and when that happens is an important date
Right.
through this whole process.
Yeah, I want to say one other thing about the PACE caregivers. If you've ever been to a nursing home late at night, you know, try it. I mean, they'll let you in. Well, not now, they won't, but I mean, back when they would let you in. You know, it's like Las Vegas in there. You know, the alarms are going off, the buzzers are buzzing, everything else, okay? You couldn't get any sleep in that joint. And think about who's working in a long-term care facility. You know, the nurses home, nursing homes say I don't like them and stuff like that. I love them. I mean, they do very important work and necessary and all the rest. But here's the thing. When you've got a caregiver in a long-term care facility, you're talking somebody who could be working 12-hour shifts 7 days a week. All right. With PACE, it's weekdays. So all the PACE caregivers have their weekends off. And it's an 8, well, you know what I mean. Except for the 24-hour, hotline. But pretty much, right? And it's an 8-hour day, 9-hour day. You know what I mean? You're not dealing with people who are at the ragged edge of exhaustion, right? They don't have to do absolutely everything. They're doing this much of it, and they're not acting as orderly and all the rest of it. It just seems to me that the individuals that you're working with in a PACE situation are going to be more relaxed. They've got, it's just more under control. None of them are looking forward to working till midnight tonight, till 2 a.m. because they don't do that. And just think about the quality, just the mental state of the caregiver who's coming out to give your spouse or your friend with MS, giving them a shower in the morning. Again, you're not going to hear me say anything bad about PACE, simply because they've done too much to be exactly what most people need. That's just the way it is.
Thank you for sharing your story.
Yeah. Come on, somebody else.
Well, I have enjoyed it. I'm going to have to get going myself. It's like those back-to-back meetings today, so.
Well, I want to thank Veronica and Sarah and Greg for sharing about PACE, your passion and your commitment. And the way they are the way the PACE people are. They just have a heart for seniors. They want to help. They want to be there for families. And they're truly amazing, just like the program.
People too bashful to sign up. They're calling you instead.
Yeah,
that's right. I see one phone keeps going on and off mute. I just want to, before we get off, I just want to make sure that they didn't have a question. They were just waiting for an opening. Looks like it's a call-in Dyer. Call-in.
So is the way that you get involved with this program to request an evaluation?
So yeah, it's a great question. So referrals can come to us in the form of a referral from a physician, a nurse, a family member, a friend, really anybody who thinks that they know somebody that may benefit from it. So yes, you would identify your local PACE program. If you're currently working with Carrier, they can help make that referral to us in your interest, and then they can work on their piece of it while letting us know that we're going to get a referral over, so that then we can start working on the medical component of making sure that you qualify for our program that way. And then we would work hand in hand with the Carrier team, letting them know what's going on with your medical situation, and them letting us know what's going on with your financial situation, so that if you do in fact qualify medically for our program, that the financial piece is taken care of, and now you can take advantage of the program with Medicaid, so there would be no out-of-pocket cost for you.
So is it still income limits, or is it geographical limits, or both, or?
So I will speak to one of those. So all right, that's a tough question. So geographically, yes, you've got to live in a service territory that one of the PACE programs does in fact serve. Sarah does the Lake Shore, and Veronica does, Grand Rapids, Kent County, and I didn't catch all of the geographic regions. And then of course I do Southwest Michigan. And then there's other PACE programs that are outside of that network. So like I said, there's 12, I think, PACE programs in the state of Michigan that represent the majority of the state. There are still some counties that are not being served. But yes, one of the lines that we work with Carrier's office specifically on is helping folks, in fact, get qualified for Medicaid. And so there are some different numbers that have to be met in order to make that happen. And that's where the Carrier team comes into play. But in the event that there's just absolutely no way that you do, in fact, qualify for Medicaid, despite Carrier's wizardry and making sure that, that he's been able to do some amazing things with many folks. But if there was just absolutely no way that you qualified for Medicaid, there is a private pay option to pay for the program as well. And it's oftentimes cheaper than what you would pay in an assisted living facility, let alone a nursing home. And then that covers all of your medical expenses and all the care that you're going to need. Whereas if you end up in an assisted living facility, you're going to pay for room and board, but then you're still also going to have to pay for all of your medical co-pays and any deductibles or anything along those lines. Hopefully I answered your question.
Is it realistic to be able to move someone from in-care nursing home to bring them home and be able to take advantage of this program?
The answer to that question is yes. We do it quite frequently. There are a couple of different programs that are designed to assist with that. Certainly, if that's something that you would like to do, again, feel free to reach out to Carrier's office. They can